Welcome, everyone. We are going to get started on our program today. Welcome to the Mirowitz Center Zoom programming for organ donation with Dr. Ying Lin from Washington University. Stephen will complete the introduction.
Thank you all for joining us. Lovely to have you with us, and especially appreciate Dr. Lin joining us as well. Dr. Lin is the Associate Professor of Surgery at Washington University School of Medicine and is an abdominal transplant surgeon. He completed his medical training at Washington University School of Medicine. There he attended medical school, trained in general surgery, and further specialized in abdominal transplant surgery. His clinical focus is kidney transplantation and abdominal organ procurement. Definitely a 21st century description of a doctor. Thank you again so much for joining us, and thanks to all of you who have joined to listen.
All right, so can everyone hear me?
Thank you.
Okay,
Yes.
so I will go ahead and share my slides here. Okay, so go back to the beginning. So can everyone see my slides? Okay. All right. So thanks to everyone for having me on. As Stephen said, my training was an abdominal transplant. So I trained in a liver, kidney, and pancreas transplant. And my focus now is on kidney transplant. And so, of course, in the course of transplanting organs, we have to procure organs as well. So today I'll be discussing the overall process of organ donation and also about tissue donation. So I think tissue donation is something that gets a little bit less attention, but it still has the potential to help many people. So this, what this pertains to is a donation of things such as heart valves, bone material, skin, etc. And I'll get into some more of this in detail later. So overall, I want to give an overview of the donation process that begins with consent to donate, also how donors are evaluated, and then how organs and tissues are procured. And if there's any questions, please feel free to just jump in and ask. Okay, so to start off, I'll describe how the process of organ donation is coordinated. So in the United States, this task is distributed to across the nation, across 58 organizations that are called organ procurement organizations. As you can see in this map, the boundaries of each organ procurement organization, or OPOs, these boundaries for the OPOs were drawn decades ago, and they're based mainly on population density considerations. So higher density states can have several OPOs. So for example, California has 4 OPOs, whereas in the Northwest, there is 1 OPO that covers all of Montana, northern Idaho, most of Washington, and it actually also takes care of Alaska. So in our donor service area that includes St. Louis, this is serviced by the Mid-American Transplant OPO. And this area covers the eastern part of Missouri, southern Illinois, and then the northern tip of Arkansas. You can see that the boundaries aren't always contiguous. So you can see here that Springfield, Missouri is actually included in our donor service area. And so within these boundaries, this encompasses 122 hospitals, has about a population of 4.5 million people. And so what this means is that if any potential organ donor at a hospital that is within these boundaries, that potential donor is referred to Mid-American Transplant Services, and Mid-America Transplant does all the work to evaluate the donors and then coordinates the entire organ donation process. So on a yearly basis in this region, again, there's about 4.5 million people, about 1,700 referrals for organ donation occur. A bit over 200 of these people are found to be eligible organ donors, and then somewhere between 150 to 200 people become actual organ donors. You see on the other side of this graphic, there's the numbers for tissue donation, and I think organ donation is something that most people are familiar with. So you see reports in the media about people getting organ transplants. And, when you go to the DMV to renew your license, you can check a box for organ donation. But there's this whole other avenue to donate tissues. And this has a great potential as well to help people. So tissue donation, what this is after a solid organ are procured from a donor for organ transplantations, then the donor can, the various tissues can be procured, like skin, portions of bones, tendons, some blood vessels, heart valves. I'll go into some of this in more detail about with these tissues, how they can be used to help people and how these are obtained. But I just wanted to introduce this idea again of tissue donation, since I'll refer to it throughout my slides. So once a potential donor is referred by a hospital to Mid-America Transplant Services for donation, obviously the first step is to obtain consent for organ donation. So many states, including Missouri, have registries where you can, for example, sign up beforehand and state your intent to become an organ donor. So in Missouri, there's a site here that you can go enter your information, and that becomes a centralized registry where you can declare your intent to be an organ and tissue donor. So if a person has not signed that first person authorization form to become an organ donor, then the family is approached to give consent for organ donation. So in addition to organ donation, the family is also asked to see what their interest is in having tissues donated, and that can be used to treat various diseases. Also, the family is also asked whether they would like to donate tissues or organs that are not able to be used for transplant, that may be able to be used for education and research purposes. So one other factor that families can consider whether they want to do something called a directed donation. So this isn't common, but sometimes a donor's family knows someone who needs an organ transplant, and if they choose to, they can actually request that an organ be donated to a specific person. So for example, I've had requests where a family of an organ donor from another state wanted to donate to a person who is listed for a kidney transplant at Barnes Hospital, and we were able to work through the logistics to make that happen. So, we always try to honor the requests of the donor family. Sometimes it's not always possible. So for example, there's another time where someone had tried to do a directed donation for a kidney, but the donor's blood type did not match the person that they wanted to donate to, and so we weren't able to make that transplant happen. Okay, so after consent for organ and tissue donation is obtained, then the OPO staff goes and fully evaluates the medical record, and they also interview the family about the donor's medical history. And so what they're trying to do is to evaluate which organs have appropriate function that would make it suitable for transplant. And so the staff will also request studies like blood work and imaging studies to take a look at the different organ systems. So for example, for the heart, they may request an echocardiogram to see how well the heart is pumping. They can also perform an angiogram to see if there's any coronary artery disease. And then for the other organs, it's typically the assessment for the organ functions are done by blood tests. So for example, we can obtain blood gases to see how well the lungs are oxygenating. You can get a liver function panel to see if there's any liver damage. You can get A1C, blood glucose, to see how the pancreas is functioning, and then a blood creatinine to see how well the kidneys are clearing blood. And so once all this history and lab and different tests values are gathered, then this is all disseminated to the various transplant teams to help evaluate this donor to see if the organs are appropriate for the people who are listed for transplant. And these different transplant teams can be, at different hospitals and even in different states. So to evaluate the organs, obviously the medical history of the donor and the results of these different tests are taken into account. But another factor that also has to be dealt with is the size of the organ. So for some of the organs, size is a consideration. So on one hand, you want the organs to be large enough size that they can adequately support the function of the person that's going to receive the organ. So for example, in most cases, you're not able to use organs from a child and put it into an adult and have it have sufficient function. And on the flip side, for some of the organs, you also have to make sure that the organs won't be too large so that they'll be able to fit into the recipient. Now, the size consideration is more of an issue for transplants where the new organ has to go into the original spot, so the original site of the patient. And so for those organs, those are called orthotopic transplants. And then there are some organs which are actually placed in a different site, and those are called heterotopic transplants. So the three solid organ transplants that are orthotopic are the lung, liver, and heart transplants. And in each of these cases, the diseased organ has to be first removed, and then the donor organ is put back into the same position. Now for the liver, because it's in the abdominal cavity, and the abdominal cavity is relatively large, there's a little bit more wiggle room. So the size mesh doesn't have to be exact, but size is still definitely a consideration even for liver transplants. So this is in contrast to kidney and pancreas. So kidney and pancreas transplants are heterotopic. And so the organs that we're born with are up in the upper abdominal area here. So for example, the pancreas is nestled under the stomach, and the liver and the kidneys that we're born with are towards the back and up high. And so when we do kidney and pancreas transplants, these organs are actually left alone. They stay in place, and for the most part, they don't affect the patient even after the transplant. So for the kidney, we actually place it down in the pelvis, and we connect the blood vessels of the new kidney to the iliac vessels. And the iliac vessels are the vessels that bring blood to and from the legs. And then for the pancreas, we all actually do something similar. We will connect the pancreas blood vessels to the iliac vessels here. So for these two organs, since they're both smaller and they're put into the abdominal cavity, which is more flexible in terms of space, so for the pancreas and kidney, size usually isn't an issue. So I had previously said that usually can't put too small of an organ into a person and have it work well, but one exception is actually the kidney. So the kidney is the one organ that we can put, for example, a small kidney from a toddler or from a small child and put it into an adult, and it'll actually pretty quickly grow into a size that'll support adult function, and that growth happens over the course of a few weeks. Okay, so after the transplant teams at the various hospitals decide that they're going to be able to use the organs, then it becomes a big logistical effort for the OPO to coordinate all the different surgical teams that have to travel to one site, where the organ donor is, and then procure the organs there. So on the left here, I'm just diagramming that in most of the OPOs in the US, what happens is that wherever the different transplant teams are coming from, they have to travel to the hospital where the donor is. So in this case, for example, if there's a donor in Springfield, Missouri, then all the teams would have to travel there. So sometimes you could have, for example, a lung team come from Chicago, maybe a heart team come from Nashville, maybe the liver and kidney teams are coming from St. Louis, and they all have to fly into Springfield at the same time to do the procurement surgery there at that local hospital. In our OPO, so Mid-America Transplant is a very innovative OPO, and they had set up a new model. So this was a couple decades ago when they set up this model, but it was the first of its kind in the nation. And they set up this system where they actually have a central facility in St. Louis. And what they do is they obtain consent from the donor family to move the donor and transport the donor to the central facility in St. Louis. So then what happens is that the various surgical teams just have to travel to this central facility and then do the procurement there. And this is really helps to simplify the coordination situation to try to coordinate the travel of all these teams. And then at the centralized facilities, all the surgical teams are able to work with a group of people who are very familiar with the transplant process. So it just facilitates the entire process. Okay, so if a donor is in a hospital in St. Louis, they can be transported to the central facility by ambulance. Or if they're farther away, they're actually flown to St. Louis. And the OPO does that in a plane that's specially designed to do this, to transport donors. So the Mid-America facility is in the Highlands Plaza, and this is a facility that's just south of the Forest Park area, and it's actually nearby the St. Louis Science Museum. And so in this facility, there's a mini ICU where the donors are moved to and cared for while the organ allocation and coordination process happens. And then this facility also has a lot of specialized equipment. So they have equipment here that allows the staff to fully evaluate the donor's organ system. So for example, they have their own cardiac cath lab where cardiologists can come and do an angiogram to see if there's any disease in the heart vessels. Just about all the donors that come to this facility undergo a CT scan to make sure that everything looks okay with the various organ systems. And then once all the logistics are worked out, then the facility has its own operating room where all the different surgical teams can come and then procure the organs. So if everything is straightforward, the procurement surgery can take as little as 1.5 to 2 hours to do. Sometimes things can get more complicated. So sometimes there are 4 or 5 different surgical teams coming from various hospitals that come to do the procurement. And sometimes when that happens, there's extra coordination that has to happen between the surgical teams, both at the procurement site as well as on the recipient side. So sometimes in these more complex cases, these procurement operations can take up to 4 to 5 hours. Okay, so on the next slide, just a quick warning that I'm going to be showing some pictures that are pictures of organs. So I don't want to alarm anyone here. So once the organs are procured, they're placed in ice cold preservation solution. So these are some pictures of kidneys that were procured. And you can see there's still a lot of this perinephric fat that's still on the kidneys that's been left there. So you can't see the kidneys very distinctly. But you can see that there's blood vessels are intact. There's a ureter. And what happens is that these kidneys are placed in an ice cold preservation solution. And then back here, the surgery teams are able to examine the organs more closely and make sure there isn't any damage or any sort of abnormalities that would prevent them from being transplanted. So before the organs are transplanted, they have to be kept cold. And the standard is to actually put them into an ice cold preservation solution, and then they are kept on ice until they are transplanted. So to try to improve this process, various companies and teams are trying to develop and test these kinds of machine perfusion devices to try to improve organs so that they function better after they're transplanted. So there are various devices that are used for heart and lungs as well, but I'll spend most of my time talking about ones for abdominal organs since they're the ones that I'm most familiar with. So with kidneys, there's a machine that's widely used, and what this does is it circulates cold preservation solution through the kidney until it's transplanted. And under the right conditions, this system has been found to be able to help kidneys work faster after they're transplanted. And so for the liver, there's also been a lot of effort to try to test systems that don't just pump cold solutions through the liver, but it actually pumps body temperature blood through the organ. So these are normal thermic pumps. So these machines are much more complex or are essentially heart-lung machines. So on the left here is a picture of a liver that's being prepared to be placed on the pump. The pump device from this particular company from Organox here is shown on the right. So this has a specialized pump here that circulates the blood. There's also a oxygenator here that does the work of breathing. And there are various monitors that closely monitors and maintains the pressure of the blood that's going into the organ, and then also it monitors the various electrolytes in the blood. So the liver that's placed on this machine can be left on the machine for up to 24 hours. And then the use of this machine has allowed us to use organs that otherwise would not have been able to be used for transplant in normal cases. Okay, so in terms of age limits for organs that are used for transplant, it varies quite a bit. So there's no absolute hard limits as to the age of the organs that can be used for transplant. As you would expect, a lot of this depends on the general health of the donor. But these are the general upper limits of organs, the age of organs that are typically used for transplant. So the most restrictive is the pancreas. It's the organ that's the least transplanted. And typically organs from younger and otherwise healthy donors are used. For heart and lung, organs up to about 60 years old will be considered. For kidneys, it's rare to transplant kidneys from donors beyond 70 years of age. And then on the other end is the liver. So this is the outlier from the solid organs, since we will routinely consider transplanting livers from donors who are 60, 70, and even 80 years old. And actually, just this past weekend, I procured a liver from a donor who is 70 some years old. It was able to be transplanted and is working quite well. Okay, so I want to come back to this topic of tissue donation. So as I mentioned before, after the chest and abdominal solid organs are procured for transplant, if the family consents, then tissues from different areas can be procured and then be preserved and used later by physicians for treatments. So for example, in my own practice, I've on occasion used preserved donor skin to do things like hernia repairs, and then also preserved veins for doing reconstruction of blood vessels to make certain organs okay to be transplanted. There are also uses for reconstruction, for example, in some dentistry applications, orthopedic work, and even some urologic work. I'm not an expert in these areas, but I would like to touch on them to give you examples on how tissues can be used to help improve other people's lives. And just a warning again, I'll show some pictures of people undergoing surgery. So again, I don't want to alarm anyone. So I mentioned before that bone material can be procured from donors, and this can be processed and preserved and used later. This bone material can be used for various types of surgeries. So for example, a couple of years ago, I had a relative who underwent a dental procedure and had a small defect in the jaw, and that person needed to have the defect filled by an oral surgeon, and they were able to use bone material from a donor that was taken and then preserved. And then that was able to be used to fill in that space. So on a larger scale, orthopedic surgeons can use this material to help manage bone fractures and fill in bone defects. Similarly, for spine surgeries, bone grafts can be used for spinal fusion when there is damage from things such as infection or trauma, or sometimes for other issues to help treat herniated discs or spinal stenosis. In terms of tendon injuries, this is an example of a knee injury that can occur if the knee is struck from the side, or if a twist happens. So if the leg is twisted and the movement occurs at the level of the knee, the anterior cruciate or ACL ligament can become injured. So in these cases, the patella ligament can be used to help in the reconstruction. So this ligament is in the front, and this ligament connects the kneecap to the shin bone. So a portion of this can be taken, bone grafts can be left on either end, and then this can be implanted to perform the ACL ligament repair. And then for urologic surgeries, for some treatments of incontinence, a piece of the fascia can be used. So fascia is a very tough material that is in place in between muscles, and then also sometimes can wrap muscles. So this tough tissue can be taken and be used to help with reconstructions. So for example, a urologist can create a sling to help kind of tent up the urethra and the lower portion of the bladder to help deal with urinary incontinence. So for example, this fascia lata portion can be taken and then preserved and be used later on for these kinds of purposes. And then skin that's taken from a donor can be helped to be helped to treat burn patients. So in this country, about 2 million people a year suffer from burn injuries, and then about 5,000 eventually require reconstruction. In some cases, skin from donors can be used to help cover burn areas and to help the healing process and for these burn areas to recover. And then veins from donors can also be taken and preserved. And in some certain conditions, this is the best way to be able to perform reconstructions of the blood vessels and restore blood flow to limbs. So for tissue donation, there are age cutoffs that are set. So you can see from this table that there are differences in age thresholds for males versus females, and also for different types of tissues. So cardiac valves have the lowest age cutoff at 55, but for other tissues like cornea, bone, tendons, skin, these all can be donated from ages 65, 70 to even 75 years old. And of course, the scale of organ versus tissue donation is different. So on one hand, for solid organs, each transplanted organ represents a saved life. There's a maximum of 6 organs that can be donated from each donor. On the other hand, tissues from one donor can be used to help many more people and greatly improve the quality of life for all of those people. So the graphic on the right, this I had shown on an earlier slide, and I just want to point out that there are almost 10 times the number of people who are able to donate tissues as opposed to organs. And in St. Louis yearly, there are, again, about 150 to 200 organ donors yearly and over 1,300 tissue donors. Okay, so this is my last slide. So we talked about organ donation, and hopefully I've given you a better idea on the tissue donation process and how tissue donation is valuable and can help the lives of a great number of people. As we discussed, age is of course a consideration in how well various organs can be expected to function. And a lot of this depends on the past health of the donor. And again, I just want to emphasize that with something like the liver, we often use livers from donors of advanced age. And the liver is the one function where there isn't a technology that's able to replace the function of that organ. So for example, for heart, there are heart lungs machine, hemodialysis for kidneys, and then insulin can be used to treat for pancreas failure. There's no technology yet that can replace the function of the liver. So that's a critically important organ. We're able to transplant livers from people, donors who are 70, 80 years of age. And finally, if organ tissue donation is something you feel like you would like to do, the most surefire way to make sure your wishes are followed on is to sign up on the organ donation registry. And even if you're not ready to do this, I think having a discussion with your family to let them know how you feel is quite important. So, many times this question of organ donation comes up with families when their loved one is in the hospital, and it's obviously a fraught time, it's a fraught decision. So if your family knows your thoughts on this, either way, yes or no for organ donation, it can really make their decision process more smooth. So thank you for your attention and time.
So we have some time for some questions. If anyone has any questions, you can unmute yourself, raise your hand, and we can answer. Dr. Lynn will answer your questions. Cheryl, do you have a question?
Yeah, I have a family member that says they want to donate their body to science. I mean, they haven't specifically said like organ donation. So how is that different, or is that different from, can you explain that a little bit?
Yeah, the organ donation process definitely has entirely its own consent process. I know, for example, having gone through medical school, we have dissection labs, and there are, from those labs, there were people who donated their bodies to education. I'm not as familiar as what exactly that consent and kind of process is, but it is a different process. Something that I can look into it and see what for example, what WashU Medical School, how they handled those kinds of donations, and we can definitely get back to you.
But, it's kind of my understanding too, that not all people, I mean, you may want to do that, but again, like you were talking with some of the organs and age and whatever,
Right.
you may not be wanted. Do you know what I'm saying? And that's just my concern, is this relative is saying, I've want my body donated to science, but if nothing's pre-done on this, then, is this really going to happen? And with them being an older person, like in their 80s, is the school even going to want someone, I guess we have to figure that out.
Yeah. So I'm sure the schools will have their criteria. Yeah.
So maybe just contact the school that
Yeah.
but like, would you, for organ donations, I mean, I saw the list of ages, like someone in their 80s, you wouldn't take anyone's organs in their 80s, essentially?
Well, so livers are definitely a possibility, and then tissues are definitely something that is very helpful for people. I would say, if there's an interest to donate, I would let the system kind of go through its evaluation and see. Yeah.
Okay, thank you.
Yeah.
Do we have other questions today? It was very interesting, Dr. Lynn. It's actually, it's just a lot to absorb. So
Yeah.
a lot of information and details that, you just don't, and some of the photos you showed, I mean, I'm happy you showed them, but it's kind of like, oh,
Yeah.
didn't know that's what a kidney looked like. But anyway, so I want to thank you so very much. Stephen, did you have anything else? You're muted. You need to unmute.
I want to add my own thanks. As Judy said, that was a lot of very important information. It's also a reminder of how far and how quickly medicine has developed, even from when I was a young person. I can recall when there was a transplant of a kidney in my small city, and it made the front page of the newspaper. And today it's almost so rote that no one even talks about it. So it's good to know that there are people like you doing wonderful work. Please continue, and thank you on behalf of all of us, not only for the work you do, but for taking time to come and speak with us today.
Very happy to. Thanks a lot
Thank
for
you
having
again.
me.
Oh,
Thank
you're
you so much
welcome.
again. And thank
And
you all for joining us.
And a reminder to everyone, this was recorded today. So if you want to look at it again, or if you do want to share it with a friend or someone that might be interested, it will be available on our website. I can also send you the link if you send me an email. And if you think of any questions that you may have, I can forward them to Dr. Lynn in the future, and maybe, something might come to mind later after we
Yeah.
digest all this information. So thank you so much. Thank you everyone for being here today. And I wish everybody
you
a happy
again.
afternoon.
Thank
So
you.
Thanks,
bye,
Doctor.